Okay, to take alginate impressions, first you're going to need your alginate material. We use fast set, and it's a chromo set, so it changes colors as it goes. So first you shake up the alginate, and there are scoops in there. So today I'm going to mix up 3 scoops. So 1, 2, 3. I always suggest you put your lid back on because it's easy to knock it over and that will make a mess. Now when I do the upper upper impressions, I always make sure I use just a little bit less than the prescribed amount of water so that it's thicker and it has less chance of it going down their throat. So try to use room temperature or warmer water, and that also makes it set up faster. The ideal is to put it in their mouth, 10 seconds later take it out. So we've got our water set, so you put the water into the alginate, pick up your spatula, and first you just stir it up a little bit to try and wet all the alginate, and then you're going to start mashing it and mixing it down the side, trying to incorporate all the powder. You can see it's turning from purple already to pink, and it's a thicker set when you do it this way. So you keep mashing it, just scoop, mash, and it gets a very nice smooth set. So once you feel like that's evenly incorporated and the mixture is very smooth, you take it out and you're going to load it into your tray very nicely, very easily, and just fill your tray completely. Once it becomes white or a light pink, that is when you insert it into the patient's mouth. So we're going to watch that and you'll be able to see how it changes color. So now it is about the color to go ahead and place it in the mouth. And that's what we're going to do. So once you've finished taking your impression, go ahead and scoop the material out of your bowl. Just kind of use the spatula and just get it off there as best you can. I usually go ahead and put it into a paper towel. Then if you take another paper towel and just wet it, it's very easy to wipe that alginate right out of the bowl, and you're able to clean it right back up. Very simple, very simple. It takes just a couple seconds to do, and you've got a nice clean bowl to move on to either your next one or when you're finished with the patient. Now we're going to mix for the lower arch. So same thing, you're going to take your fluffed up alginate, you're going to shake it first. I'm going to do 2 scoops. You usually need 1 scoop less on the bottom than you do on the top, but you'll be able to learn that as you go as to how much you need. So again, room temperature water. I don't warm it up on the lower because I do want it to be a little bit looser mix. So I use the water exactly at the height for 2 scoops. Then we're going to place that in. I want to show you the difference in the mixture of this. So again, you're going to stir it up first, get all the powder incorporated, and then you're going to start flattening it out. You should be able to see that it's a little bit runnier. It is definitely a looser mix. I want it to be able to go in and underneath the tongue and around the teeth better on the bottom, but it's definitely a lot looser mix. So again, it's going to the pink now. You'll be able to tell the difference when you're mixing it, that it's much lighter and easier to flatten out than it was the other way. So then take your mix of alginate, load it into your tray. Nice and easy. You can see it's drippier. It definitely will be able to do what I needed to do around the tongue and around the teeth. So again, you just wait till it turns a light pink. and then insert it into the mouth.